Good afternoon. Just kind of close this door so you don't have the background noise. Good afternoon. Is everyone ready? Good? Great. Thank you. So first, I'm joined today, obviously, by Dr. Martell. Again, thank you for your leadership that you've shown throughout this entire pandemic and leading our county and all of our citizens through this pandemic and now into the vaccination stages. So here locally, we are encouraged by the continued lowering positivity rates and the fewer new cases that we're seeing. Our hospitals are beginning to see that slight decline in patients that they're treating for COVID-19. Now, more than 10,000 healthcare workers have, some of the hardest working heroes throughout this entire pandemic, have received their first round, and many are already receiving the second round of their vaccine. I want to say a thank you to our healthcare workers for all their brave and tireless work. I want to thank those in the community who continue to take this pandemic seriously and are doing everything that they can to keep themselves and their family safe and healthy. We've been on this road now for just over 10 months, and it's been, I would say, easily to say, difficult for all of us. The small sacrifices, and sometimes not so small sacrifices, that every citizen and every employee is taking is paying off and is helping our community now in the long run. So as I've mentioned, we've been seeing that progress in Winnebago County and in Region 1, and I want to speak on that briefly. We are anticipating that there could be a move from our current Tier 3 mitigation to Tier 2 as soon as this weekend. And I want to preface this, folks. I don't want anyone at home to think myself or Dr. Martell is being coy. We get information from the state, and once in a while, we may not get that information far in advance of all of you. So we are trying to prep while also understandably maybe not having the full picture ourselves, okay? We are anticipating that there could be that move from Tier 3 mitigation to Tier 2. I want you to know I am advocating for some modifications to Tier 2 limitations with state support also for small businesses. So what would this look like if there are no changes to Tier 2? Tier 2 currently includes the ability for limited capacity professional, social, and group meetings indoors. Tier 2 does not include the opening of indoor bars and restaurants for indoor services. While Tier 2 does not include indoor service, consistent with the City of Rockford's past practice, we have, as you all are well documented, limited resources from an enforcement aspect, meaning limited staff to enforce the mitigations that the state has mandated. So we would really prioritize our enforcement on wearing face coverings, practicing social distancing, and contact tracing records. This would include tight requirements on the masking, social distancing, and logging of patrons into facilities. We could also see a limited reopening of organized group recreational activities with attendance limits. This does not prevent our county or state partners from taking any actions to enforce the letter of the Tier 2 standards. This helps keep employees and their customers safe. We're entering into the stage of progress. We know it has been very slow and at times painfully slow, and we also recognize that we have a long way to go. However, I am pleased that we may be taking some small steps towards a broader reopening of our economy that is safe for our employees and customers and citizens. We continue to advocate again at the state level for relief and for support of small businesses and support for our residents, and we will continue to do that. Again, as we say, and I have said at every one, we really need to continue to be vigilant. We're seeing that positivity rate decrease. I would add, along with that vigilance, we also need to be patient. We're going to hear from Dr. Martell. We need to be patient with the vaccine rollout, as all of our healthcare partners and Winnebago County Health Department are doing a phenomenal job working as fast as possible to make sure that that vaccine gets out to all of our citizens. So with that, I'll turn it over to Dr. Martell.
Thank you, Mayor McNamara, and thank you again for your leadership of our largest municipality in Winnebago County. So throughout this pandemic, we've kind of made a little bit of a mnemonic about the P's, right? We've planned, we pivot, and we're going to talk about patience. So the vaccination plan. Winnebago County continues to work through the vaccination of the expanded Phase 1A. So we've had to constantly pivot and plan as they expand out the capacity. We are working through the second doses of the healthcare workers, and I've tried to really kind of explain this before. So everything we did, let's say week 1, in 3 weeks with Pfizer vaccine, we have to replicate. If it's Moderna, it's 4 weeks. So you kind of have to have that, I'm going to call it in like sporting, a bye week, right? Where we're just catching up on the second doses. Because for this vaccination to be effective, it needs the 2 doses to get the 95%. So we're working to vaccinate residents of the community integrated living arrangements. Today we are out at Milestone vaccinating. And between all systems, and the mayor referenced it, over 10,000 doses have been administered. And over 3,000 healthcare workers in Phase 1A have completed their initial series, meaning that they've received their 2 doses. The Illinois Department of Public Health has put up a dashboard that reflects vaccination by residency. And so I always say we're challenged in Winnebago County because we're a large employer. So many individuals come into our county and they are being vaccinated as part of that healthcare workforce because they care for patients or have an office here, but their residency is outside of the county. So I don't want people to say it's a 1-for-1. We are here to vaccinate those healthcare workers right now in Phase 1A that are in Winnebago County. Working with healthcare system partners, we've kind of put out a challenge to all of us. We would like to minimally, collectively vaccinate 5,000 per week. And people, different organizations have stepped up to the plate. We talked a little bit about this during the hospital phase. It's not about the beds, it's about the staffing. So it's not always about the vaccine, it's going to be about the staffing. Because we're continuing to provide healthcare services. Crusader Community Health has stepped up. Marathon Health, which is the provider of Rockford for their occupational medicine, is going to be stepping up to help us. Mercy Health System, Oak Street Health System, OSF St. Anthony, UI Health Miles Square, Swedish American, and of course the Health Department. We have put out a collective challenge. And we understand this is going to be difficult because most of the time we're taking care of patients that present to our systems that are our patients, but we have a community to vaccinate. And so we're having to kind of work through some of those. If you're a healthcare provider who's willing to vaccinate community members, please reach out to the planning team by calling the hotline, 815-319-6705. 815-319-6705. All hands are needed, all hands on deck, as we say. So as we pivot, we expanded the healthcare group to Phase 1A, and we've been working through that group, which is very diverse and very large. These are providers not affiliated with hospitals. Things like dentists, mortuary care, blood bank, physical, occupational speech therapist, home health agencies, optometrists, and the school nurses have been coming through. So we've been trying to vaccinate this very large expanded group. We've talked about the congregate facilities that are outside of corrections that were not eligible to be matched with Walgreens or CVS. So when they could not be matched, it was up to the health department and its partners to vaccinate those individuals. So we've been looking at the Milestones, the Stepping Stones, Mosaic, and other entities like that that could not be matched. Simultaneously, I know we're all excited about the transition to Phase 1B. So we're going to be doing Phase 1A and Phase 1B together. And I know we know Phase 1B represents almost over 2/3 the population of our county. It includes those aged 65 and over. Fire responders, first responders include fire, law enforcement, 911 dispatch, security personnel, school officers. It includes our educational system, the teachers, the staff, the support individuals in pre-K through 12, those who work in food and agriculture for our food processing plants in Winnebago County, and agriculture, our veterinary medicine. Selected manufacturing, not all manufacturing, selected manufacturing. Corrections, including workers and detainees and inmates. The Postal Service. Public transit workers, including our Rockford Mass Transit and our ride-sharing companies like Uber and Lyft drivers. Our grocery store workers, think about how essential we know they were. They're going to be part of this, and shelters and adult daycare. So when you think about trying to vaccinate that population, I want people to understand, I'm going to say it multiple times over, we are in a marathon, but we are gearing up, we pair up, we are doing it every day, and we need your patience. The good news is that over 32,000 of our community residents have registered online. That's a tremendous lift and support for us because that's one less staff person we have to put toward that. We can instead make sure that all our staff are out vaccinating. I reiterate that Phase 1B includes almost 2/3 of the population of Winnebago County. And once you've registered, I've heard, well, when do I get my appointment? Is that going to be tomorrow? When's that happening? It will be prioritized. So I've got those occupations, right? Age, risk factors, and zip codes with our highest disease burden. From the start of this, we said that we had community zip codes that had suffered the highest degree, and we will be bringing those through first so that we can make sure that we are getting the most vulnerable. And I want to remind everyone, you may be vaccinated outside of your usual healthcare provider. Because similar to what we said about treating and administering COVID patients, is that we're going to function as one system. And that's a hard concept. It's a hard concept for the healthcare providers. They're used to being good primary care providers to patients enrolled with them. But we have to function as one system if we're going to vaccinate as one system and vaccinate our population. Because the same healthcare workforce that has cared for you throughout the pandemic has shifted to provide you with vaccination. And as I explained before, operations have to be replicated at 3 and 4 weeks, depending on the vaccine, to ensure receipt of that second dose. Just receiving one dose, at this time, the FDA is not saying that it will provide the level of protection we need. And vaccines each have their own logistical challenges. Shelf life, you're hearing about this freezer, we have to put them out the night before, we have to kind of know who's going to come to the clinic so we can defrost the right amount because they have a shelf life once we start defrosting. They have different storage requirements. We talked about the Pfizer and the ultra cold, and if I could show you the big box of dry ice they ship me to kind of re-scoop it on every night, you realize this is not like we normally get for vaccine. But good news is both Moderna and Pfizer have produced bonus doses. Typically, Moderna was supposed to get 10 doses out of vial. We were able to get 11. And out of the Pfizer, we've been able to get 6 to 7. And all of the clinics that are working to vaccinate are working not to waste a single dose. So sometimes I hear, well, I heard so-and-so got a vaccination. Well, if we're at a place and we've got 1 dose left to go, we'll say, does anyone need to be vaccinated? And typically we get 1 person. But we might say, it might be the volunteers at the hospital. We pull them through and we vaccinate. The idea being that we're not letting anything go to waste. But that does not mean we are phase jumping. And I think it's important for people to understand that counties are at different phases based on their populations. If you have a chance, you can look at that map and you think, wow, we're a very large state, very diverse in population. We know that the northern part of the state has more population. We tend to be employment centers. Rural have less, but they still need to be vaccinated, and we still need to make sure we have plans for them. But a couple of things we have to talk to everyone. You should not be charged for registering or making an appointment. If you get a call and they want to charge you money for registering or making an appointment, stop. Don't give any information. Do not provide your Social Security number. And do not provide anything about your immigration status. We know already that there are attempts to either fraudulently claim money out of this vaccination effort, send people solicitation that I can get you a vaccine sooner or later. I want to caution the public. Go to our website. We know that there's some that cannot do that. Try and work with a family member to register you. For some of our citizens, we're calling them that need help going through it. We will work that through. Because we want to make sure we're using a trusted system. And we don't want you providing personal information to a system that cannot be trusted and is not going to provide you the vaccine. Coming back to this, it's a marathon, not a sprint. I'm with you. I wish it was a sprint and we could say, in a month from now, we'll be done and we can return to life as normal. But we're not there yet. And if we want to continue to be able to open our businesses safely, our schools have returned to in-person. We understand from all of the schools reporting that they have more children returning as part of the in-person learning environment. We're going to have to continue to wear our face coverings when outside of the house, regardless of vaccination status, practice social distancing, wash hands frequently, stay home when you're sick. I'm still amazed. We still have not lifted that. There's no new rule that says, please power through this. We want you to stay home. Our employers are continuing to encourage to have people work remotely as much as possible. Limit your contacts. And with that, today's the numbers we'll be reporting. We have new cases for today is 104, which brings our total case count to 24,505. The ages in the cases were 10 months to 94 years. And unfortunately, we have lost 2 additional of our community residents, which brings our total death count to 380. Our heartfelt sympathies, again, are with the families during this time frame. It is very difficult to lose a person to COVID and not be able to be there with them. Our test positivity rate is 10%. The regional is 8.9. So we got a little work to do here, folks. Even though we're optimistic that we're going to be coming into Tier 2, we have to work hard to hold that line. And we've been in mitigations since October. We've worked hard to get these numbers down, and we are going to continue to have to work hard. We're reporting our recovery rate at 98%, and we have one location of concern, which is a home for the developmentally disabled, Glenwood Terrace. And as of yesterday, Rockford hospitals were providing inpatient care for 101 patients who have tested positive for COVID-19. And this is a decrease from Thursday's report of 102. And while that's one, we're going to have to continue to hold the line. So again, reminding the population, now our third word is patience. So we're planning, we're pivoting, and we're trying to encourage each other to be patient. We will vaccinate everyone who wants to be vaccinated, but it will not be tomorrow. It will not be overnight. We do not want people lined up in cars where they are stuck in lines that they can't. We know that different members of a household might be in different phases, in different priorities, but our goal and intent is to vaccinate everyone safely and effectively. So with that, I'm happy to take any questions.
Dr. Martell, you mentioned sort of a plan for moving to phase 1B. I'm just wondering if there's a timeline as to when you think that will happen, or a date specifically you're looking to hit that mark?
So the question is, do we have a date or timeline for phase 1B? We're hearing mid-January, right? We're getting close to mid-January. I'm going to say, I always say mid-January is like 15th of January. But again, the governor will be announcing that because he wants the entire state to move. The challenge will be, as I've said before, it won't be like the next day, everyone over 65, come on over and we're going to vaccinate you at the CVS. That can't happen. That's not how this is going to work. There's vaccine logistical challenges, and I come back to there continues to be an issue with the vaccinator staff. We are vaccinating. We've pulled everyone in. I hear from people, can you get volunteers? Yes, we do. We use our medical reserve corps that includes medical students, nursing students, retirees, interested community residents who say I can help with registration, in addition to the staffs of our systems. But we are vaccinating almost 7 days a week at this point.
So those people who are in phase 1B and go to get vaccinated, are they going to be vaccinated at CVS, or is this, like you said, Swedes, Mercy, Oak Street, et cetera? Or
We will be
all-
presenting, as we pull them through the system that they've registered in, and they meet the criteria for Phase 1B, they will be presented appointments at any one of the locations that is participating. And then they will be able to make their choice. They'll schedule both their first and their second, right? Because I don't want you to think and you're going to forget your second dose because, one dose doesn't do it. And so that will come through. So what I'm saying, though, is I've heard people, I said, well, I just go to the local pharmacy. They can give it to me. And the answer is no. The local pharmacy will not have the vaccine to administer to you.
So if you had to speculate, when do you anticipate the time will come where everyone who wants a vaccination will be vaccinated?
So the question is, what does that timeline look like? And I'm going to pull you back into the state of Illinois plan where they showed you that I'm going to say a graphical chart. Probably we're talking 4 to 6 months. And at that point, we've kind of gone through most of our priority groups. But you also know that people that decided maybe in Phase 1A I wasn't going to go, or even Phase 1B, and now they've seen more information out on the vaccine, decide to come part of it. But I don't want everyone to think that this is a 2-week effort and we're done. First of all, it wouldn't work, right? I've already told you, I have to kind of go through a bye week where we are going second dose before we can move on to first doses of the next group.
Has that idea changed? I hear that maybe at the national level they're releasing all of the vaccines all at once.
So the question was at the national level, releasing all the vaccine at once. So typically what they were planning to do, this is my understanding, and again, they were releasing 50% of the doses so they would hold back the second dose. They've been working with the manufacturers to make sure that that flows through. So they're trying to release as much as possible to begin that first dose. But the rate limiting is not only just dose of vaccine, it's the number of people to be available to vaccinate.
So just to be clear, when does CVS and Walgreens come into play?
CVS and Walgreens are the partners for the long-term care facilities, and they have been going into the long-term care facilities to vaccinate. And when you look at the plan, they're typically much later in the phase when they would be doing as part of their retail footprint. Because you wouldn't want 200 people showing up at, a footprint of the size of their stores.
But people will eventually be able to walk into a Walgreens or CVS and get the vaccine. That's the part I'm wondering,
When will that, again, I'm going to put my crystal ball out and say that that's when vaccine availability is high and the number of people needing it is much lower.
So, Dr. Marte, you said Phase 1B, that group consists of 2/3 of the county's population, adults and children?
Well, children are not yet included,
Okay.
right? Because we're not vaccinating anyone under the age of 16 because we do not have a product license for under even emergency use authorization for under 16.
Thank you for that. Is there a 1C category?
There is a 1C category, and we're working with the state to kind of go through. Because we talked to you some manufacturing, so I'm going to probably give you a hint that probably more manufacturing, some of the more production areas. And again, I think we start to learn, as I said, how many people are in all of these different groups. You can imagine if we said manufacturing, there is no phasing then. And I think that that's the challenge that we've had throughout this pandemic. Think from the very beginning. Remember when tests were limited, then we didn't have enough test supplies, and we get more test supplies, but not enough. This seems to have been, I talk about supply chain issue. So it's not only just the product or item itself, but then it's also the technical staff to do it. And so this has been, we kind of catch up and then we move forward. So our goal is to come into the phase and vaccinate as many as we can, as quickly as we can.
You said a handful of healthcare workers have received their second dose. Talk to me a little bit more about the responsibility of the individual after they receive that second dose. They can't just go out without a mask and be safe or anything like that, right?
That is correct. So the question was, after I received my second dose, which is about 3,000, which makes sense, right? Because we were talking about the trays that came in the first. Can they go out without their face coverings on? No. Did they get a badge that says I'm vaccinated? Not to worry. Because we still have some unknowns on this vaccine, right? And we talked a little bit about that last week. But while the vaccine is highly effective at preventing the individual from contracting the disease, we don't know if it prevents transmission of the disease. So me being vaccinated, and I take my face covering off and I go with you, I could still transmit to you who's unvaccinated potentially. We also don't know if we need we've heard some of the initial data of how long is this vaccine good for, and do I need another booster, right, after the 2-shot primary series. So we have a lot of information that we're working with and really trying to pivot and get as much as we out there and plan as we learn more information about how to do this most effectively. But I do want to remind the population we are working very hard to get this out to you. We understand you are all very excited, as we are. This is, I mean, the acceptance of this vaccine has been phenomenal. But I also have to say it's going to take us a while. But we're going to get you. We're going to get to everyone.
Dr. Martell, we've heard nationally this thought of herd immunity. Is there a county-wide number that we would have to reach to get to a herd immunity thought process, or is that not something that we're considering at this time?
The question was about herd immunity and the percentage. And so I've heard Dr. Fauci say between 70 and 90. Really, we're aiming in the state of Illinois for 80% of our state's population to be vaccinated, to understand if we are really achieving, that's what they believe will achieve, a significant level of herd immunity, meaning more of us are protected than not protected. And so those who can't be protected for some reason, then by virtue would not be susceptible to the disease because we're protecting them.
So we have to apply that to the state. We can't apply that concept directly to the county.
You could apply it directly to the concept of the county as well. So if you took, 285,000 being our population, 80% of the 285,000.
Dr. Martello, you talked a little bit about some of the scams, unfortunately, that have been connected to the COVID-19 vaccine. Is there anything you could tell us about, when you do go through the health department's portal, what will it look like when you get your email back from the health department? Is there anything people should be on the lookout to say, oh, this is, legitimate versus not? Can you talk about that
Yes.
a little bit?
The question was, how do you know it's legitimate? First of all, we've asked people if you want to put the link on your website, we will put that on your website. So if you are a resident, agency that wants to put there, we will give you that link. We don't want you sharing it where it can get corrupted along the way. Then the other, through social media, things like that, the other portion is when you get the confirmatory email, it will have an @wchd.org email address. Now, it takes about 24 hours because it goes out and comes back in through the server. Technology is, we're working through some of that. It's not like Amazon. I said we don't have that kind of series system here. It would be great. But the idea being that it would come through with that legitimate email address. We will not ask you for insurance. We will not ask you about your citizenship status. And we will not ask you for any payment. So if anyone gets a call or anything of that nature, if you want to call it in the hotline, we greatly appreciate it because we know there are probably some operators out there that are figuring out how to make a little bit of extra money on the side, illegally brokering or marketing the vaccine.
Can you repeat the numbers again of how many people were vaccinated in the county?
Sure, and this, the number was asked to repeat the number vaccinated, and again, it's on the state website as well as it was as of this morning. Over 10,000 doses have been administered and over 3,000 healthcare workers.
Is that the healthcare workers have received, is that 3,000 total, just one dose, or is that?
That's the 2-dose. When we say have completed the initial series is a 2-dose series.
Dr. Martell, right now there isn't a definitive data research on how the vaccine could impact nursing or pregnant women. So is the county taking a stance on that? What's the advice and directive there?
So the question is, there is limited data on it. Was not tested on pregnant or breastfeeding women. So we are following the position statement of the American College of Gynecologists and Obstetricians, as well as the the Academy on Immunization Practices, that is recommending that the risk of contracting COVID is greater than the risk associated with vaccination. But every pregnant woman, we are vaccinating pregnant women. It's not a contraindication, but we also encourage them to have that conversation with their primary care provider, their OB provider.
You talked a little bit about Tier 2. Obviously, the big one in there that everyone's looking to listen for is indoor dining. That doesn't seem to be on in the cards right now, but you did say you were having personal discussion with IDPH. Is there any update on indoor dining in the state line?
Well, and I think the mayor put it very well. The question is indoor dining on the state line. And I want to caution people because I don't want anyone going off ordering food and things like that if you've been, adhering to the guidelines. Tier 2, as we knew it before, did not include indoor dining. We are all advocating for some relief to allow, in a very controlled situation, so that we can identify contacts, risks. We talked a little bit before about how that would look. But I know both the mayor, through the governor's office, and through the Illinois Department of Public Health, we're looking at that, how can we do some of these activities in a socially responsible way that reduces the transmission? Because we don't want to have to do another shutdown, here we go again. We don't want our positivity rate clicking back up again. We've worked, I think, what a hard climb this has been since October.
I know, I hate to speculate, but what would that look like? Is there a certain capacity restriction that you guys have been discussing if it comes into tier 2 play, or?
The capacity, the question is, have we given a particular capacity? Well, I think that one of the things we've looked at, again, where you can maintain, I always say it's not about capacity, it's about your ability to maintain within your footprint of your restaurant 6 feet between outside of your household. So some footprints are larger than others, and I have to think of, you really have to be cautious, right? Because we want to be able to make sure that the tables are 6 feet apart, right? And I've heard, is that chair to table or chair to chair, because you sit in a chair. You're not sitting on the table. So we're going to go chair to chair. And the other part that we're really going to talk about is, can we get the air exchangers going? Because, right, we're moving indoors now. It's been kind of chilly. I don't know. I'm not ready for sitting outside in a cold tent right now. So making sure that we have adequate air exchanges, and then also making sure that households are sitting together. And I know that, the mayor talks about that as registration, reservation, whatever we want to term it. But again, the idea being that we know who's in the establishment at any one time. So if there is a case of it, then we can quickly identify who needs to be quarantined. Because as I said last week, we're still fighting this on several fronts. We're still testing out there. We're still contact tracing. Every day we still have cases. We have to go out. We have to quarantine the contacts to those cases and make sure they're isolating appropriately.
Mayor, what do those conversations look like to you? You said that you've been advocating for indoor dining in tier 2.
Yeah, so the question is, how do those conversations look like for me, assuming between me and the governor's office? So I would say very similar to what Dr. Martell has said. We have been advocating, I would say, for some time now, some reduction of the mitigation efforts. I certainly, I really think at this point our restaurants, well, I would say a couple of things. One, I think we know more. Two, I think our citizens are taking this very seriously, and by citizens I also mean the customers as well as the employees and the employer. Three, I would say our business owners definitely don't want to be open and closed again, so they also really are aware of how serious they need to take it. They've done a really great job by and large for the last 3 months now of this, and the very last thing, which is for many of them and others, is always the biggest talking point, but I want Rockfordians to be proud. It's one of the last talking points when I actually talk to business owners, is their financial aspect of it. It's a very real point. I believe that some capacity they can open, and when I say capacity, I agree with Dr. Martell. Capacity, I use that generally, it is really that social distancing aspect. But, I mean, I was on the phone twice today with the governor's office, having my thoughts on it and encouraging some loosening of those mitigations. I think we're moving in that direction. We're just not there ready yet to announce that. But
so you believe, Mayor, I'm sorry to interrupt, that restaurants and bars can reopen to indoor dining responsibly while observing COVID-19 restrictions?
yeah, and let me make sure I get that question right to repeat. Ken, do I believe that restaurants and bars can open responsibly while following COVID-19 mitigations, protocols?
Yeah.
And I want my answer to be clear. When I say this answer, it doesn't mean that our city is doing this, but yes, I do think to some extent our restaurants and bars are able to open responsibly, and I think you'll see us move towards that direction over the time period.
Mayor McNamara, have you received a COVID-19 vaccine?
I have not, and by the list that Dr. Martell said, it sounds like I'm in phase 3F or something. I don't know, but I'll take it the day I'm allowed to have it. I'd love it. But obviously, there are, on a more serious note, the question was, have I taken the vaccine yet? I have not. I'm not up in my phase yet, and take it as soon as I can, but I know that there's folks who need it far more than I do right now, and I hope that they get it, they sign up for it. I hope every Rockfordian does, and everyone in Winnebago County does.
Did you get a vaccine, Dr. Martell?
The question was, have I been vaccinated? And yes, I have been vaccinated.
So phase 1A then?
As a phase 1A, I'm going to say the overview, right? Because we said no wasted dose. We got a call one day saying, get on over here, get a vaccine. So yes, I was vaccinated as phase 1A as in the healthcare worker group.
Tough to speculate, but do you know where Mayor McNamara falls on the phase list?
We're all wondering.
Minus 1F.
1F. Okay.
This may be for Dr. Martell or Mayor McNamara, but those conversations that you guys have had with the governor, we've done here before where we've sort of speculated whether or not indoor dining was going to come back, and then it hasn't. So what needs to happen for that to come back? Is the governor's office just need to sign off on it, or what's the protocols for this?
And I'm going to say someone's phone is 0.
You want?
Want me to?
You
You
go.
can just leave it.
Okay.
Just let it go, yeah.
Just so I get that, Rich. Question was, we've been here at this stage, not this stage, but we've been at this point before where we have hoped something may happen, and then once in a while it doesn't, or once in a while it does. What is that turning point to get it to happen from the state, right?
Yeah.
Well, I guess in short, when the governor and the state announces it, it happens. So I won't say I know everything that is involved in their decision process. I would say just as any other viewer has, some have faulted them for this, but I would say they've been incredibly conscious and have prioritized the health of all citizens, all employees, and all employers throughout every decision. So until the governor feels comfortable that everyone is safe to open responsibly under those COVID mitigations, he's not going to do it. I would say, and I won't speak for Dr. Martell, but I think when we're advocating for it, we're not saying, hey, we can do this because businesses have to have it. We know that. We've known that since March 13th, that businesses need to be open. But the hard part in our positions, and again, if I'm misspeaking, let me know, is we know our businesses need it, but we also know we have a greater responsibility for the health and welfare of our citizens. And so that's what he's balancing. So we have urged him, stating, or I should repeat that, I have urged, stating I fully believe our citizens here in Winnebago County, and Rockford specifically, have taken this very seriously. I think you can see that through our school system, through our healthcare providers, through the wonderful job Dr. Martell has done, and through all the mitigations that our businesses have done, specifically with those restaurants.
I have one more.
Okay.
Do you want to see if she responds to yours first?
Would you like to respond to that, or no?
And I would echo the same thing as the mayor. We've been here before, but I think we've demonstrated that our region has come down and consistently coming down. But again, we can't let our guard, right? So if we get this, and we say you have to do a certain thing, this is not time to, again, we as patrons, right, going into the establishments, as workers, as employers, need to be following it. Because oftentimes, remember, the good news is our complaint hotline, we're down a number of complaints, right, from the start of this. Now we're more interested in the vaccination. But remember, we all have to do our part so that our businesses can stay open, our schools can stay in person, because it is a long-haul marathon. And every so often, I know we get a little tired and we kind of let it break down, but to be in mitigation again for 3 months it's been very long and hard for our businesses.
I have one more question for you, Dr. Martell. Should we be taking precautions now that the COVID-19 variant has been found in Wisconsin?
So the question is, should we be taking precautions now that additional precautions? So this is a question about, as we look through all of this, the same precautions need to be taken. This hasn't changed, and I know we get tired of wearing a face covering, you know, maintaining social distancing, keeping within your household, keeping your contacts and being very intentional throughout that. I think we saw that, you know, as a region, we did pretty well over the Thanksgiving holiday and fairly well over the Christmas holiday, that kind of break. But again, we can't let our guard down, because if it's more transmissible on this one, we're going to have to even double down. So if we try and open and we say it has to be 6 feet apart, only at and we find out that it's not, we're giving that virus that opportunity to spread.
Dr. Martell, last question from me is just about the vaccine's impact. Have we seen that in Winnebago County yet? Is the vaccine helping drive our numbers down, or is there not data to quantify that yet?
The question is there data yet on the vaccination to see whether it's driving the numbers down? And the answer is not yet. And I think we're continuing to watch, because we've got, when you think about, only 3,000 have received the full series shot, so meaning they have 95% protection. We have people that have been exposed in between dose 1 and 2. We've had people still, you know, get sick after the first dose. So understand that we are continuing to monitor that. And obviously that's now one of the questions that is asked at contract tracing. Have you been vaccinated? And what product were you vaccinated with? So this is why even people that are vaccinated will continue to wear their face coverings and will continue to do the social distancing and stay intentional about their contacts. Anything else? Thank you. Have a great day.
Thank you.
Thank you.
Sorry. Oh, that's...
I heard you say one out.